There are 38 new positive cases of COVID-19 in Trinidad and Tobago. According to the latest Ministry of Health COVID-19 update, 3 of the positive cases are repatriated persons. The ministry says the number of cases reported reflects samples taken during the period March 21st to 23rd and not the past 24 hours. What this means is that the number of total active cases now stands at 187. Of those cases, 12 are patients in hospital, while 137 are persons in home isolation. At this time, there are 242 people in state quarantine facilities. Karapi Chaima and Chase Village are some of the areas with the highest number of COVID-19 cases. Manager of the Geographic Information Systems Unit at the Ministry of Health, Roshan Siram Singh, on Wednesday, provided data to support earlier statements that County Caroni has recorded the highest number of cases.
As well, and this is what the map allows us to do when we look at the data spatially. We see that general Chase Village, Karapi Chaima, Balmain area around there, those areas are what we would say hot areas in which we would have recorded a high number of cases. And of course, these are areas we need to look at.
When analyzing the cluster of cases, Mr. Siram Singh said there was a decrease in cluster spread within families when compared to epidemiological weeks 6 to 9, which is between February 7th to March 13th. But the trend soon changed during week 10 to 11, which covers the period March 7th to March 20th.
At epi weeks 10 and 11, we see that 33 out of the 43 persons who were identified as persons within clusters, these are spatial clusters we are discussing, 33 out of the 43 were linked to someone else within a family or the same home or the same address, which is about 77%. So this is still significantly high.
Siram Singh encouraged people to continue to follow the COVID-19 public health regulations. The County Medical Officer of Health for St. Andrews St. David is issuing a warning to parents and church leaders ahead of the Easter weekend holiday. Dr. Alana Best said parents should prevent their children from participating in certain activities.
And I'd like to remind parents that camp activities are not currently permitted. We have to continue to safeguard our children, and certainly families can do things as a unit, and where possible, these could be outdoor activities or in areas that are well ventilated.
Dr. Best said church leaders should also know how many people are within their congregation during service.
Religious leaders, we know it's the Easter time. It is also a good idea for you to have a list of persons attending each service so that in the event a positive case were to arise, we can more promptly do a comprehensive contact tracing exercise.
Prime Minister Dr. Keith Rowley has confirmed that Trinidad and Tobago is set to receive COVID-19 vaccines from both India and China. The Prime Minister says the government of India today officially informed the government of Trinidad and Tobago that 40,000 doses of WHO-approved AstraZeneca vaccines have now been approved for donation to Trinidad and Tobago. Additionally, the People's Republic of China has offered 100,000 doses of COVID-19 vaccines to the government of Trinidad and Tobago. Dr. Rowley says the government has graciously accepted this generous offer of the Sinopharm vaccine as it anxiously awaits WHO approval. Prime Minister Rowley has expressed his sincerest appreciation and gratitude to Prime Minister Narendra Modi and President Xi Jinping. All relevant arrangements are being made for the shipment of the vaccines to Port of Spain.